Good day, everybody. Telemedicine Center of Lugan State Medical University presents an introduction to the clinical examination of patients, as demonstrated by Ivanova Larisa Nikolaevna, the head department of propaedetics of internal diseases. Today, we're going to be learning about the general inspection of the patient. In general inspection, the first thing we do is to assess the general condition of a patient. The general condition may be a good, satisfactory, fair, or poor. This is followed by assessment of consciousness. Consciousness can be complete or incomplete. Incomplete or deranged consciousness is classified first as stupor, then as stupor, and finally as coma. Then we look at the attitude or posture of the patient. The posture may be active, passive, or forced. In inactive posture, the patient can perform all tasks that the physician asks of him, or he can readily change his posture depending on the circumstances. In the passive posture, it is seen in unconscious patients or in very ill patients. A forced posture is often assumed by the patient to relieve or remove pain, cough, or dyspnea. For example, in orthopnea, the patient sits, leans forward, and grabs his knees. In this posture, blood flows due to gravity into the deep veins of the legs, relieving the patient of pulmonary edema. This reduces dyspnea and aids the patient in breathing, as it also fixes the chest. This is followed by checking the response of the patient. This is assessed by asking the patient general, everyday questions like what he had for breakfast or how is the weather outside. Depending on the patient's response, it may be adequate or inadequate. An inadequate response is usually seen in various psychological derangements. The countenance or facial expression can indicate the mental composure and various psychosomatic conditions. Normally, the facial expression is serene or benevolent. A few examples of pathological expressions are facies mitralis, corvisats facies, facies fibralis, crisis sardonicus, and facies hippocratica. Facies mitralis, as seen in mitral stenosis, is characterized by crimson discoloration of the chin and cheeks. The gait of the patient is seen when the patient comes into the examining room. It may be normal or it may be abnormal. Few pathological gaits are a shuffling gait, usually seen in old people, and waddling gait like a duck, which is seen in dislocation or dysplasia of the hip joint. We assess the bearing of the patient when we see the patient from the front, from the back, and from the sides. While observing the patient, close attention must be paid to the level of the shoulders and the curves of the spine. Seen from the side, the spine may have a thoracic kyphosis or a lumbar lordosis. From the front and especially from the back, the patient may have a scoliosis. While observing the patient, we should try to determine his age visually. In conditions like scleroderma and hypogonadism, the patient looks younger than his biological age. And in conditions like diffuse atherosclerotic disease or a pituitary adenoma, because of increased secretion of hormones, the patient appears older. Then we determine the height and weight of the patient. We use this information and calculate using special formulas to compare with specific indices that are available. Then we measure the circumference of the chest. The circumference is measured in a flexible tape in centimeters. The tape is wound below the scapula, coming front above the breast. The circumference is determined normally and during deep inspiration and during deep expiration. Coming to the constitutional types and proportion of different segments of the body. The constitutional types may be normasthenic, asthenic, or hypersthenic. To determine this, we measure the epigastric angle. An epigastric angle that is 90 degrees is considered normasthenic. Less than 90 is asthenic and more than 90 is hypersthenic. While examining the skin, the color of the skin, elasticity, scars, pigmentation, stretch marks, scratch marks, signs of trauma, and moisture must be determined. Elasticity of the skin is usually seen on the dorsal surface of the hand. The turgor of the skin is decreased in disorders of water and electrolyte balance, which is usually seen in chronic renal failure or in people with diuretics. Normally, it is seen in elderly individuals. This is demonstrated by taking a skin fold and holding it for a few seconds. Release usually brings the skin back to normal. Decreased turgor is indicated by the presence of wrinkles. While assessing the appendages of the skin, we look at the visible mucous membrane, the hair, the nail, and the teeth. The angles of the mouth may be cracked, and this is known as angular stomatitis. Angular stomatitis usually occurs in vitamin B deficiency. The sclera is examined by pulling the lower eyelids downwards. A yellowish discoloration of the sclera is known as icterus. Icterus is seen in jaundice. Sometimes the bulbar conjunctiva may be injected. It is usually seen in conjunctivitis, or there may be hemorrhage under the bulbar conjunctiva known as subconjunctival hemorrhage. This is seen in hypertensive crisis. The lower palpebral conjunctiva is a good place to look for pallor. Pallor is an important sign of anemia. This is followed by examination of the hair. The hair on the head and body distribution of the hair is determined. While examining the hair of the head, close attention is placed to the shine, the sheen, the color, the thickness, the flexibility, and distribution of the hair. We look for dandruff and seborrhea and areas or foci of alopecia. The body hair distribution differs in male and in females. A male pattern body distribution of the hair seen in females is usually encountered in hormonal conditions. This is known as hirsutism. While examining the nails, we look for the color, any pittings or grooves on the surface of the nails. The color may be changed in conditions like acrocyanosis, which is usually seen in peripheral vascular diseases and congestive heart failure. Horizontal patches of white are usually seen in deficiencies of vitamins and iron. Watch glass nails are characteristic for congenital and chronic diseases. Now we examine development and distribution of subcutaneous fat. To examine the development of subcutaneous fat, a skin fold is taken as shown. In males, the skin fold is usually half a centimeter to 1 centimeter thick. In females, the skin fold is more than 2 centimeters thick. Then we look for the presence of pedal edema. While examining the legs, we press the bony surfaces of the leg and look for pitting or non-pitting edema. To examine the muscular system, the physician asks the patient to hold his hands as shown. This allows for assessment of strength, tone, symmetry, and complete or incomplete development of the muscles. To determine this, the patient is asked to actively overcome the resistance that the physician is offering. Examination of the skeletal system involves looking for deformations because of fractures. Tenderness can be assessed by tapping as shown by the physician. While examining joints, we look for swelling, crepitations, tenderness, and range of movement of joints. Movements of the joints may be active or passive. Active movements are when the physician asks the patient to move his joints. Passive movements is when the physician moves the joint for the patient. While examining the spine, the physician runs his fingers or thumb along the spines of the backbone. This leads to erythema of the skin over the spines. Looking at the line that has been created because of this erythema, we can determine the presence of lateral deviation of the spine known as scoliosis.